Good morning, Good morning, everyone. I'm Dr. Vandana Shetty. I'm a consultant obstetrician and gynecologist at Ascent Raheja Fortis Hospital at Mahim. I have been in practice for the past 20 years and I have been attached to Raheja since the past 10 years. Today I'll be talking to you about two topics. First is frequently asked questions in pregnancy, and second being common gynecological problems. Pregnancy is a very important event in every woman's life. The moment you come to know that you're pregnant, a number of questions pop into your head. Today I'll be trying to address a majority of these questions. If there are some which are still not addressed in my talk, I would love to hear from you. The very first way that you come to know that you're pregnant is a missed period. And to confirm that you are pregnant, nowadays most women do a home pregnancy test. A home pregnancy test is a urine pregnancy test. There is a kit which is available in any medical shop, and you can do it at home by just adding a few drops of your urine. Two lines come on the kit, which means that you are pregnant. But still, many women are unsure. Is this really true? Am I really pregnant? Yes, there are confirmatory tests, and you can definitely visit your gynaec to do the same. So, when a woman first time comes to me with a missed period and with a kit showing two positive lines in the suggestive of pregnancy, I tell her 99% I'm sure that you're pregnant. But if you still want to confirm, we can do a blood test known as a beta hCG blood test, or we can confirm by doing a sonography. A sonography will tell you 100% that your baby is fine. It also tells us about the growth of the baby. It tells us how many weeks you're pregnant, and it also tells us whether your baby is doing well, whether the heartbeats are there. Sometimes there may be a difference into your period dates and the growth of the baby. So that also we can pick up in the sonography. But the early sonography we can do is generally around the 6th or the 7th week of pregnancy. After this, the second question that the lady will ask me or my patient will ask me is, now what do I do? What do I eat? What are the changes that are expected now? Okay, so that's very likely. Your first time you come to know you're pregnant, and the first thing that comes to your mind is, oh, should I be doing this? Should I be doing that? Should I be eating this? Should I be eating that? Yeah, there are certain things that you should do. There are certain things that you shouldn't do when you're pregnant. And every time the instructions are different depending on which trimester of pregnancy you are in. In the first trimester, that is the first 3 months, the changes are different. In the next 3 months, that is the second trimester, from the 5th month to the 7th month, the instructions are different. And in the last trimester, that is from the 7th month to the 9th month, the instructions are different. First 3 months, we have to be very careful about what we are eating and what we are doing, because it is still a crucial stage in your baby's development. The baby's brain is getting developed, his or her organs are getting developed. So it's very important that you eat the right kind of food and you take the right kind of medicines. As a gynec, I will give you folic acid supplementation, which is very, very important for your baby's brain and spinal cord development. Then we will give you certain medicines to take care of any nausea or any vomiting that happens in pregnancy. At the same time, there is a lot of bloatedness, there is constipation, there is morning sickness, acidity. These are common because your body is going through changes. There is a hormone called as progesterone which starts increasing in your body, which causes all these GI changes, we call them, that is changes in your stomach, in your intestine and your gastrointestinal system. So what do you do in this situation? How do you take care of yourself so that you don't feel very bloated, you are fine, you are able to manage the morning sickness? Eating the right kind of food is important. Do not eat very salty, very spicy food in the first 3 months. Yeah, there will be a difference in your taste. You won't be able to feel the taste of food at times, and you will feel like having that pickle or that spicy wafers, something chatpata. But better avoid that. You can have it once in a while, but not every day. If you have it every day, then you will feel acidic, the digestion will not be proper. So have lots of fruits, lots of salads, lots of vegetables in your diet. Eat regularly. Every 2 to 3 hours, you must eat something or the other. Yeah, I understand sometimes women say, I'm not able to eat anything at all, there's no appetite. But if you do not eat regularly, then the acid levels in your stomach will increase and you will feel like vomiting all the time. And then when vomiting sets, it is very difficult to control. So the way to prevent all these changes is to eat every 2 to 3 hours small amounts of food. Not like how you used to eat before, breakfast, lunch and dinner. Now you eat 5 meals in a day. Hmm? You start your day with some warm water so that it cleanses your system. Then have some fruit followed by a breakfast. Try to keep the timings regular. Otherwise, if you skip your meals, then again bloatedness, acidity and giddiness, that is feeling of weakness, is very common. By this, then have some coconut water or some juice between your breakfast and your lunch. Try to finish your lunch by 2 p.m. in the afternoon. Have some salad in your lunch. Have small amounts of everything. Previously, if you were eating like dal, sabzi, roti, rice, now do not eat so much at one time because your stomach will not be able to take it in. You won't be able to digest it. So what you do is have some salad. Have maybe one roti, then you can have a katori of dal, and now do not have rice again. You can have rice at night. So have one thing at a time, which you'll be able to digest and your stomach will be able to retain. Then you can have some curd or buttermilk. That is also good. It's recommended in pregnancy. Then you can have a light evening snack, and if you're working, then preferably when you come back home, have your dinner as soon as you come back home. Dinner also you can have some salad. Now you can have your rice or a khichdi or some soup. That is nice. And before going to bed, if there is a gap of more than 2 hours between your dinner and your sleep time, then you must eat a midnight snack or a bedtime snack, we call it, because then there will be a lot of gap between your dinner and your next day breakfast. So if you manage yourself well in these first 3 months, eating regularly, avoiding spicy, oily, fried food, avoiding something very very salty and which is very sweet, is what will keep you healthy and your baby also healthy in the first 3 months. Do not take any medicine without consulting your doctor. Avoid, if you are used to having lots of coffee and tea, keep it to a minimum. Take only once or maximum twice in a day. That also, if you can reduce, it's better. Then caffeinated drinks like Pepsis, colas are a no in the first 3 months. Another thing that you must avoid is alcohol and cigarette smoking. These are not good for your baby. They can interfere with the baby's development. Besides this, any other issues that you face, your doctor will be able to solve them. These are the most common ones that patients come up with. There will be changes in your breast, your nipples will start getting sore, the veins in your breast will become a bit prominent. That is also normal. You will feel constipated, that is also normal. So that's why a high fiber diet and drinking enough good amount of water every day will carry you through the first 3 months. Besides that, your doctor will give you something to soften your stools and help with the constipation. Now, as we move forward, There will be certain tests that we will be doing in the first 3 months, blood tests to see whether you are not anemic, you do not have any thyroid problem, your sugars are normal, and what is your blood group. Then we enter into the second trimester, which is from the fourth month to the sixth month. In between the third trimester, as you start with your second trimester, there are certain tests there's another test that we do, which is an important test to see if there are any genetic problems in your baby, known as a first trimester screening test. It consists of a sonography and a blood test. It detects three major genetic problems that can cause mentally challenged child. So this is recommended, though it is not mandatory or compulsory. Followed by this, as you enter into your second trimester, that's the best time for you. The pregnancy is settled, the baby is settled, the bloatedness, the nausea, the constipation is better, the, the taste of the mouth improves. You start feeling, better, you start feeling energetic, your appetite comes back, and this is the best time. If you want to travel, you can travel now. Though we tell you to restrict travel in the first 3 months, second trimester is the best time to travel, to do whatever you want, but you have to remember that you're pregnant at the same time. And the next second trimester, it's basically the baby's organs which have developed. Now, their further growth and development takes place. The muscles start growing, calcium deposition happens in the bones, and the baby's overall length and size increases. Now you will start feeling the first kicks. By the 20th week, that is the fifth month, most women will start feeling the movements of their baby. Before that, generally, movements are not appreciated, though your doctor can feel the baby's heartbeats on the Doppler and from the 16th week onwards. Now you can eat. There are no restrictions as far as food is concerned. You can eat meat also. You can eat fish, eggs. In fact, protein intake is recommended in the second trimester onwards, because your growing baby for the muscle development requires a lot of proteins. So fish, eggs is good for your baby. Chicken also, red meat we tell you to avoid, but if you're used because of the constipation and digestion issues, but if you're used to taking that from before, that also you can eat. There are no restrictions as far as food is concerned in the second trimester onwards. But definitely be careful about, again, the other things like alcohol, cigarette smoking, and eating lots of salty and sugary foods is not recommended, because tendency for blood pressure or diabetes, if you have because of your genetic because of your parents or anybody in your family, if you have that genetic tendency, it may come up for the first time in the second trimester. Your pressure will go up, or your blood sugars can go haywire. You can become diabetic for the first time in pregnancy. So you have to be careful about the amount of sugar you are taking, about the amount of salt you are taking. Do not put excess sugar from the top. Do not eat ice creams all the time or the chocolate all the time. So just be careful about what you are eating, and enjoy the pregnancy as it grows. An anomaly scan is done in the 19th week. It tells us about the baby's organ development, the heart, the kidneys, the eyes, the fingers, the legs, the hands. Everything is properly grown. That's the most commonest question women have. Is my baby all right? Is my baby growing well? Yeah, this is the scan which will tell you that your baby is definitely fine. It is healthy and everything is going well. As you enter into your last trimester, we'll be repeating your blood test again to see whether you have developed any sort of anemia, whether your sugars are under control. Once we do this test, which is around in the 7th month, start of the 7th month, then in the last trimester, it is now just wait and watch. We have to be watchful about the baby's growth. We have to be watchful about, now we are just waiting for the baby to come, and we're waiting for its growth to happen, so for it to develop completely, for all the organs and the muscles and the bones to develop. So calcium intake is very, very important now, because deposition of calcium will happen in the baby's bones. So you taking your tablets regularly is very, very important. The iron tablet, the calcium tablet, and sometimes if you feel you're not putting on good weight, we will tell you to have protein powders also. But many women, if they are good with their protein intake, that is, they are taking good amount of eggs, fish, then maybe sometimes we may not even give it to them. But if we feel there's a lag in the growth, if I feel or if a doctor feels that the baby is not growing well, then we will recommend another sonography sometime between the 7th and the 8th month just to have a look at the baby's growth. Or maybe if you're not putting on good weight, then we'll tell you, if you're working, we'll tell you to take it easy, to be at home, to take rest so as to reduce the stress and allow you to put on more weight. As you near your term, there will be certain exercises we'll be recommending. Like regular walking is something that is recommended throughout pregnancy. If you do anything that makes you fatigued, that makes you tired, we tell you to avoid that activity. But as you near your term, and if you're very keen for a normal delivery, then definitely being physically active will ensure that. Go for regular walks at least for 15 to 20 minutes every day. Then you can start with proper exercises like squats and duck walking, or even like walking staircase 1 or 2 floors is good. It makes your muscles stronger. It allows you to be prepared at the time of delivery, shortens the labor time, and ensures a normal delivery. If for some reason you are under bed rest, then once you enter into your 9th month, then usually your doctor will recommend that now you need not be on bed rest. You can continue with whatever activities are recommended, like regular walks, at least 15 to 20 minutes. You can increase it to 30 minutes. Then we'll recommend squats to be done. Then we will tell you to walk steps, walk staircase 1 or 2 floors, and be and eat. Continue with your diet, and as we'll be doing another sonography, which is usually it's called as a color Doppler test, to see that the growth, the blood circulation going to your baby is adequate, then the water inside the baby into the water bag is adequate, what is the weight of the baby, whether the baby is underweight, whether it is adequate weight or it is overweight. In the last few days, nearing your delivery date, we will be telling you to keep a watch on the baby's movements. This is very, very important, especially after meals. Listening to the feeling and keeping a watch on the baby's movements ensures that your baby is doing well. There are certain tests that we do that is known as a non-stress test. It tells us that the pregnancy is going well. In a high-risk pregnancy, suppose you develop diabetes or hypertension in the first during your pregnancy, then these tests will be done more frequently, maybe every weekly, and sonography also maybe every 15 days. So it all depends on how your pregnancy is going. Once you near term, your doctor will repeat the sonography, will see the position of the placenta, will see whether normal delivery is possible, and once you are nearing your term, once you go in labor, you have to get admitted, and that's the best time of your life. You'll be seeing your baby, and if you take good care of yourself in the first 3 months and the next 6 months, I'm sure most of you will have a healthy baby, and your delivery and your pregnancy, everything will go smoothly. Thank you.